Hello, everyone, and welcome to Above and Below, the podcast of the Construction Industry Alliance for Suicide Prevention. I will be your host today. My name is Sonya Bohmann, and I am the executive director. Zolk cannot join me this month, but he will be back in November if you're missing him. Today, I'm really excited to continue this conversation. On our last podcast, I had Cal Beyer with me, and we had a great conversation about recovery and recovery-friendly workplaces. And today we're joined by our friend Nick Williams. So gentlemen, I will let the two of you introduce yourselves again, Cal, and for you, Nick, for the first time for our listeners.
Sure, Sonya, thank you so much. And Nick, it's great to be with you. Looking forward to our conversation as usual. I'm Cal Beyer, Senior Director for Safe Workplaces at national nonprofit Safe Project. And been a long time admirer of Sonya and the work that the Construction Industry Alliance for Suicide Prevention does. Thanks for shining a light on this intersection between mental health, substance use, and suicide.
Yeah, my name is Nick Williams. I'm the CEO of the Subcontractors Association of Colorado. Run my own business called Rise. We do consulting, speaking events, and education surrounding recovery-friendly leadership and recovery-friendly workplaces. And I'm also very excited to be here. I'm lucky enough to call both of you friends and colleagues, and I can't wait to continue the conversation.
Awesome. Well, thank you both for being here today. As we know, September is Suicide Prevention Month, but it is also Recovery Month. And at CIASP, we chose to separate those conversations so that we could give them both enough light and attention and have real conversations about both, which is why we've chosen to have these conversations in October versus September. So again, thanks for being here, and thank you for the work that you do. It is outstanding, and that's really what we want to talk about today. So let's continue this conversation, shall we?
Perfect.
So I would love for you both to sort of set the stage for me and for our listeners on why we actually need to be having this conversation. I know that there is a lot of buzz on LinkedIn about why recovery shouldn't even be part of this conversation, or we shouldn't be talking about substance use, and they're not a wellness conversation, and there's no intersection between suicide prevention and substance use and recovery. So let's pull the Band-Aid off. Nick was like, whoa, you just dropped a lot of stuff there, Sonya. So go ahead. Tell me your thoughts on that. All of the things I just said.
Wow. Why there shouldn't be a conversation about the congruency of the risk factors associated with suicide and overdose. The two are inextricably linked. The work that I do, if we're talking about saving lives, which is what we should be talking about, is health and safety, or even in public works or in service. I think it's really integral that we continue that conversation. For those that want to separate it, I can understand the instinct, but hopefully we can fill some of that area with some knowledge and some understanding so that we can continue that conversation with folks and that they can understand we really need to be approaching these things at the same time.
I think what I'm hearing you say is we have to address this intersection. If we don't, we're only focusing on parts. We're not seeing the whole. And this is a puzzle, and we're looking for missing pieces of the puzzle. And if we focus only on those conversations that feel safe today, we're missing opportunities to help people who are challenged or struggling with other issues. So for many years, we didn't talk about suicide prevention in the workplace. It was taboo. And then when we started talking about suicide prevention, it opened the pathway for us to talk about underlying mental health issues. The same is true with substance use. And we need to do the same to address those underlying issues. If we're afraid to have these conversations, we're not leaning into offering help to people who might be struggling. I want to challenge people, Nick, like you're doing, is have those courageous conversations. And if we're afraid to, we have to explore why. And a lot of times it's out of lack of knowledge, a lack of resources, not feeling prepared. And I think, Nick, you are so correct in the way you described that. And that's why I'm happy you're here today as well. You're doing great things to close those gaps.
Well, and I'll respond by saying this. I embrace the total worker health model, and we cannot approach worker health and safety without thinking of our workforce as a full person, right? So top to bottom, inside and out, that's what health and safety really means. And so, yeah, you're right, Cal. Like, we weren't having the conversations in the health and safety world around suicide prevention until we realized we were losing 5 times as many people to suicide as we were to actual health and safety risks. Well, you think about that and you start to understand how many folks we're losing to overdose, misuse, addiction, alcohol abuse, etc. And you realize the problem is much more significant. And when you realize that the person is a person, complicated, difficult, nuanced, right? People are those things. Then we have to approach health and safety as a difficult, nuanced, balanced. These things are inextricably tied together. So if we actually want to have a positive effect on making sure that we take care of people, then we really need to focus on the whole person.
I think that's a great point. So when we talk about that whole person or the intersection between these things and how it relates to that whole person, let's then relate that to the workplace. How does this show up in the workplace?
To me, it shows up in a lot of different ways. And it would be any unresolved stress, not just substance use.
Sure.
It could be caregiving responsibilities that are a burden and a person who doesn't have adequate resources. It could be a person who is dealing with the various stressors in today's life and living, whether it's economic, whether it's employee health benefits, maybe it's family, relational issues. It could be substance use or misuse. There's a whole range of factors. Could be financial pressures, right? So when Nick is talking about this whole person, we want to address this idea of worker well-being. And our well-being programs have to address physical health and emotional health. But what will happen, Sonya, this will show up as tardiness. It'll show up as absences, missed deadlines, deteriorating quality of work, a person who is distracted, maybe leaving work early. There will be this idea of presenteeism, being physically present but emotionally absent, checked out, disengaged from work. And this is what allows this for a personal, private conversation. Are you okay? And are you really okay? And what's going on? And we have resources to help you. That's what I wanted to say. It's not that substance use is going to look different in all cases. It's going to look like the conversations we're already having. We're just not having them when a person needs this support.
I mean, those are all the things you just talked about, are all the things that we talk about when we're looking and talking about risk factors and warning signs with mental health. I mean, there's the intersection right there, Cal. Absolutely.
I believe, obviously, what Cal said is right on the money. When you're talking about your workforce, grief, anxiety, depression, end of life care, succession planning, hypertension, substance use. I mean, these are all pieces of the puzzle. Financial wellness is a huge piece of the puzzle. We can dive into that a little bit more. But the thought I wanted to say, Sonya, how does this show up? How it's shown up for me as a business leader and as a leader in the association space for subcontracting and construction. I was talking about how this shows up the work for taking care of people, truly taking care of people and meeting them where they're at. What it looks like in the workspace, what it looks like as a leader, is creating a safe environment for people to just be authentic and vulnerable. How that translates is myriad ways. There's so many different things that can happen in that type of environment. But what's more important than anything is what Cal and his work has taught me, taking a no shame pledge, creating a safe environment, making sure that people understand that whatever it is that they're dealing with in their life, it can be a list of 20, 30 things, right? We all deal with our various set of circumstances every day in our seasons that come and go. If you create an environment in which folks can actually come to you and say, I need some assistance, I need some help, that's all we're really talking about. So that help might look like something like, hey, I'm trying to get a house loan and I'm really trying to figure out how to, level up for me and my family. Can you plug me in with somebody that can maybe help me with that? is very similar to the way that someone would come to you and say, hey, I'm really struggling with drinking more than I would like to. I'd really like some resources to make sure that that doesn't continue. Can you help me with that? If we get an environment where people are able to actually vulnerably come to you and have that kind of conversation, meeting them where they're at only means taking care of them in that moment, in their moment of need. And that need can change and differ. I think the tough part of the conversation that we get to is that there's so much stigma and nasty language and understanding, and our culture has really put a value judgment on folks that are struggling with substances in a way that's different from struggling with other physiological disorders or things that you're struggling with in your life, when really it's no different. But somehow our culture has really placed that differentiation, and it doesn't allow us to really just have those open, safe, vulnerable conversations like we would with anything else.
So Nick, it's so funny not funny, ironic, I would say, that you see that, because as you were talking, I was thinking about the language that goes with mental health and how we are trying to change the thought process around that. And you said, there's all this nasty language that's out there. And I would think it's even more labeling than when you're struggling with a mental health disorder. And what is the change in that look like? Or what should the change in that look like, I guess, is a better question.
Well, I'll let Cal go. I'll briefly just say it looks like kindness, empathy, compassion, putting yourself right back in their shoes, being, I would say, void of ego and pride, and understanding that most of what I've ever done is make mistakes to get where I'm at, and understanding that we are all fallible, all moving along through this mess together. And we've all been part of the mess at one point or the other.
Sure.
And so understanding that we are no different, stopping the otherizing, putting people in corners, putting people in segments, and just realize and recognize we're all the same. We're all here to help each other, and no one's better than the next person for any reason. So I think that that's an important piece to start with.
I think Nick is right on the money. I think the only words you didn't use that I sometimes use would be respect, dignity, and an idea of grace, whether it's spiritual grace. I'm not talking about religious grace, but this idea of acceptance and meeting people where they're at is what you're describing. When we treat people as humans, Nick, you talk about this so eloquently. I love it when you do. Then the only obligation we have is to treat them with respect, kindness, compassion, and demonstrate that concern. People will meet you differently when you meet them with those character attributes. So I think that's really important. I think, Sonya, you're also referring to what we call person-first language.
Yeah, absolutely.
We had to teach a new language when we taught people about suicide. And one that you and I talk about often is how do we recondition people and maybe reprogram people to not use the common language that was associated with suicide and blaming people for dying by suicide. So we changed the language from committing suicide to dying by suicide. And we've given examples of how that changed perspectives within families, within workplaces. Even where multi-generational loss has occurred, people start to see it through a different lens. The idea of person-first language is similar. It's a person with substance use disorder. And that idea of person first is don't put the label first, put the human first. And it tends to humanize. It takes away the blame. It's intended to take away the shame. And it ties to medically accurate language. We're talking about substance use disorder, which is a treatable chronic health condition. And that's one of the things I love about the movement in Colorado and nationally that Nick is part of, that a recovery-friendly workplace acknowledges that. And then we have a responsibility to help people by pointing them to resources. And that's why this is a workplace topic. We have health benefit plans, whether they're union or company sponsored, and employee assistance programs are part of it.
So I think that people are obviously, just like with mental health, concerned about coming forward. Nick, you had talked about what that kind of looks like a little bit because they're worried about labels or they're worried about being thought of as not being capable of doing their job. So what does that look like from an employer standpoint? How do we support that person? And I know the respect and all of that has to come first because we do have to put the person first, but how does the employer put practices into place or put policy? And I know we don't love the word policy, but they have to exist theoretically. So what do we do to create spaces that allow everyone to have that same access? I guess is really what my question is.
It always starts with leadership. And I don't mean that the leaders must start or lead the cause. That's not what I'm saying at all. What I mean is that the style of leadership and the kinds of leaders that we have, especially in the construction industry, needs to and must change. So the best leaders in construction are transformational leaders. They're also transactional leaders. I think one of the hardest things to understand in construction and other industries that create and move things around, manufacturing, oil and gas, mining, those kinds of industries, really good transactional leaders are extremely necessary in making sure that our business continues. So they're really great at filling out checklists, getting inspections done, making sure that things are taken care of in the way that the drawings are put together, the engineering stamps are there. But there's a lot of transactions that need to happen, bank, finance, all those things, right? Okay. So we have these great transactional leaders that do a really good job and they get promoted and then promoted again. And then all of a sudden find themselves in charge of a team of 30, 50 souls. And they've never been trained how to actually manage people. Because at the end of the day, when you manage transactions and then you look at people, well, people are not transactions. People are not assets to be managed. People are people, and nuanced and strange and weird and addicted and kind of crazy, right? We all are. So let's just admit and understand that if we're going to try and manage people the same way we manage transactions, we are going to fail every single time. So if we're able to train our leaders how to not only be great transactional, amazing leaders in that way, but also transformational leaders and take their teams, create an atmosphere like you're talking about, Sonya, where people can trust and respect and be part of collaboration and maybe even, dare I say, innovate, right? If you're given that kind of environment, then our industry would actually be better for it. So if leaders are capable of really addressing their folks as people, as those really difficult kind of things to manage, and stop thinking about them as assets or transactions or things that exist on some sort of plane that can be, I don't know, like policy driven or protocol driven. They're not bots. They're not droids. It's not going to work. So how do we actually see them where they're at, meet them where they're at, treat them as human beings? I think if we actually lead our industry and lead our companies in that way, then recovery-friendly workplace practices just become as a byproduct of those same efforts and energy.
Cal, I love the idea of leading, obviously, with heart. But I'm a PM at heart. I like process. I like policy. I like boxes. I like lines. And I would suspect that some of our listeners do too. So what can they do to either put in or take out of policy or of process so that they know how to do this?
For me, Sonya, there is that balance between the two dimensions,
right,
in our industry where we have the leaders. And I love the way Nick defines and describes that. Mm-hmm. What I have seen, much like with suicide prevention, until we broke it down in what does it mean to meet people where they're at? How do we initiate that conversation? We had to teach people about warning signs. We had to teach people how to marshal resources. I think one of the biggest gaps that I have seen, and it's been confirmed over and over, is most of the hesitation I see is that people don't feel prepared to have these conversations. So there are plenty of resources available, whether it's your city or county health department, social service, intergovernmental, or even nonprofit organizations. There are recovery specific organizations with certified peer support specialists who serve different sectors in this space. But very few of us have reached out and invited them in and received information and felt comfortable sharing that information because it's outside our comfort zone. I think back to 2014, 2015, when we were getting ready to launch the Construction Industry Alliance for Suicide Prevention. We had the same hesitation, the same hesitancy. So we need to overcome that, learn how to initiate the conversation, learn how to share resources. One of the systems that I use for leaders has been the 3 Vs, being visible, vocal, vulnerable supporters. But when it comes to having the conversations, I use this idea of 3 Ps. It's being prepared, be private, and then be present. And give that person undivided attention in private with the attributes Nick and I described earlier. But with preparation, share with them things you've read, things you've learned, things that you've attended meetings and gained knowledge from. And then ask that person open-ended conversations and listen with empathy and then reflect. Don't try to fix, just be there for that person. And I'm concerned about you. I've never had a person say, get out of my face, back off. And the last thing I want to just highlight, Nick, we can talk more about this. We sometimes wait for a crisis and we miss our early opportunities for early intervention because we don't feel ready. We're afraid to have the conversation. We make it an away game instead of a neutral game. And by an away game, it's hard to win on the road. If you wait till the time of crisis, defensiveness sets in. But if we have those conversations early, I'm seeing you're struggling with workload. Do you need support? Is there guidance? Do you need resources? How can I help you? Then if you get excuses, you have an opportunity to intervene. Hey, we talked about this. Is there something more I can do to help you? So I think that's where we have to get, is the conversational expertise. And it starts by being prepared.
I think that's a really great point. But how, just thinking about mom life and work life and conference life and all of the things that we do, when consumption is so mainstream, how do you know when too much is too much and where and when you should have these conversations?
So I'm a father of 5. And Nick, if you wanted to jump in, we had these conversations early and often with our children. And we looked for warning signs and we would ask questions and conversations, and we look for opportunities to maintain that bridge and to talk about friends and behaviors. And is it possible that there's substance use? And what do you think the outcome of that will be? And we were framing those conversations because my wife and I recognized that we needed to have those conversations. Parents have the most protective factor. Unfortunately, a lot of parents don't realize that the world has changed. Mm-hmm. I hear frequently, thank God they're only vaping, but they won't know what they're vaping. Or thank goodness it's only marijuana, it's not something more. But are you aware of today's concentrations? Are you aware of what that risk is? Do you use that word consumption? Do you know what your child is consuming and what the health effects may be? So, Sonya, it does start with that up front. That's why I came to work for a SAFE project. We have a director of full spectrum prevention and a director of recovery. We have the opportunity to partner on that whole spectrum. And that's where change will happen, is when we embrace this in the workplace and stop fighting it, stop resisting it, let people know that help is available, and have them lean in and seek guidance.
Nick, you were going to say something and then I jumped in with my next question. Sorry about that.
That's okay. I was just going to follow up on the conversation regarding how this actually gets put in place in practice. And the first thing I always tell leaders that are interested in doing any of this type of work is just like with any other transformational practice, do not be afraid to fail. Remove your ego and pride from the equation and understand, first of all, you're going to fail. And that's okay. Right? That's how you're going to learn. That's how you're going to sharpen this new muscle. And then second, there is a huge network. To Cal's point, there are people in your community right now, inside of your industry. I don't care what it is. Inside your industry, the local university, the municipalities, the Centers for Health Work and Environment. There's people in your community that are ready to and want to jump in and help with you. You are not going to do this alone. You're not going to do it right every time. There's a lot of freedom there, knowing that, all right, we can just get the work started. We don't actually need to have the entire roadmap in front of us. And I think what Cal was alluding to earlier is let's not wait for the loss of a life or the loss of someone's humanity or soul. Like, let's actually just start the work because it's the right thing to do. And then as we move along, we can talk to our partners. Here in Colorado, we have unbelievable partners. And, I think of some people like David Shapiro at the Centers for Health Work and Environment. I work together with the recovery community. You have Melissa Woodring, LB Bork-Coulter, Melissa Williford, all these people that are really ready to jump in and help you understand how to actually manage these situations. Mark Ashby comes to mind. These people that have been indispensable parts of my network, friends at this point, that have helped me move through and stumble over and pick myself back up again when I was doing the wrong thing or really approaching things in a way that I didn't understand. I didn't get here on my own. You can't do it on your own. And the beauty is no one's expecting you to. So engage the network, engage the people who have the energy, the intention, and the expertise to really support you down this road.
Cal, what about you there? Thoughts on the support process? What can I expect as someone who is trying to shepherd someone through a process of coming forward and saying they need help? Where do I go as a leader to get that help, to create that space?
Yeah, I think both Nick and I, Sonya, have shared some of these ideas of these localized resources. I've been challenging HR and safety and risk professionals. Let's build a vetted list. Let's be curious. Let's make outreach calls. Let's invite people in. Let's ask our employee assistance program for guidance on who are some of the local organizations we should attend. We need to do better in our recovery communities as well to do outreach to employers. We're seeing that in Washington State. The Washington Recovery Alliance shows up and tables various industry events. And as we do more of that tabling, we're starting to build those bridges. I've been in contact with a group in Oregon called Oregon Recovers for the same reason. We need to do more capacity building with the organizations who address workplace issues for pre-apprentices, apprentices, tradespersons. But it comes by the organizations, the employers, or the labor unions to help connect the dots. We can be trusted guides, Sherpas, if you will, to our employees to seek out those resources. If we have relationships, it's going to be more credible. It's going to be more trustworthy. If we bring in strangers and just introduce them without knowing them. So that's one of the things that I make an effort. And Nick, you and I talk about this a lot. How do we engage that whole support community? And
I think it's important first to create and have a great set of resources for your employees to be able to access. So, right, like a good EAP and good contact information that's vetted and tried and that someone has actually called recently to make sure it works, right? A great carrier that encourages or at least has access to primary care mental health providers, high quality access or high quality care and equitable access to that. Third party people, BuildWell Health is a partner I've worked with before, but peer recovery resources, straight to employee resources, remove HR from the equation. Having, certain apps tied to your carrier, having people understand what 988 is and that it's not just suicide intervention, but rather crisis intervention. If you're dealing with any sort of crisis, you can call 988. And then you put all those resources together. And then what I encourage businesses to do is create a roadmap, like literally put on a piece of paper, I am an employee and I feel like I drank too much, or I'm really having thoughts of harming myself, or I woke up this morning and I didn't even really care if I was here anymore. Put those thoughts on a page, put those thoughts that some of us have had more than others. Put those thoughts on a page and then draw little arrows and say, this is who you should call, and put the number right there, and go through training and make sure that they understand that when you're feeling this way, this is who you can contact. If you make it that easy, that simple, you really actually are meeting people where they're at, and you're taking care of them in the moment by pre-training them, by helping them before they need it, know who to call in a situation of need or crisis.
What a powerful exercise. I love that. I really think that could get a lot of use in a lot of different spaces. I really like that a lot. So I have a final question for you guys, 2 final questions for you guys, but to be a little bit provocative here, what is frustrating you about this conversation still?
What frustrates me is this absence of honest engagement about this intersection of substance use. Many organizations feel we've got it covered because we have a drug-free workplace policy and we have drug testing protocols. So Cal, we got it. We don't have this issue. Nick, you and I talk often. Companies do have this issue. It's latent, it's hidden. If it hasn't emerged, doesn't mean it doesn't exist. How does your drug-free workplace policy and testing protocols help people? It probably doesn't. It probably is a barrier that keeps people from seeking help. It definitely keeps people from disclosing that they need help. A last chance agreement or a second chance agreement isn't enough either. So we need to be really intentional about letting people know support is available. And the third is a lack of curiosity, waiting for someone else to solve the problem rather than rolling up our sleeves and doing the work like Nick described, like I've described, by finding those local resources. They're looking for ways to offer help. The last comment I'll make, Nick talked about if HR doesn't feel comfortable or doesn't want to be in that role, there are other organizations that can provide some of that caregiving navigational help. There are apps available. And then there's an organization that's called Soberant, and the leader of that organization, Marin Nelson, started a program at Salesforce called SoberForce, and now she does that care navigation. Follow her on LinkedIn. Look at how she has these conversations. We are breaking down barriers, Sonya, but we need more people to get a critical mass to flip this the right direction.
Thanks, Cal. Nick, how about you? What frustrates you?
Well, there's 2 things come to mind. One is what Cal already touched on, and that's just that, I understand it. I was a director of operations in construction for 15 years, and I didn't want to believe that what everyone was telling me was true. If what everyone was telling me was true, that we had a severe epidemic in our industry of folks that were utilizing substances in a way that was harmful to their life, that meant that I had to first identify those individuals, figure out what I was going to do about that. So it was a lot easier to bury my head in the sand, attribute it to the management perception gap, say, hey, I don't see it. We have good testing protocols, but we for sure don't have an issue here. The first thing I tell organizations when I come in and work with leaders right now is you for sure do have an issue here. There's no doubt in my mind. It's just a matter of identifying who needs help, what employees need intervention, what type of intervention, and what type of protocols and systems are you willing to put in place to actually help these people? Because they do need help. That is for certain. So I think that I agree with Cal on that piece. And then honestly, like I said, I tried to lead with empathy on all this as a former director and being in this industry and working with so many business owners every day like I do. This is tough work. It's messy and it's difficult and it's not ever the same. And there's no really one good system or protocol that's ever going to be set up in a way that's going to meaningfully help each individual. recovery journeys are unique. And so is the way that we manage and deal with them as leadership. So I think one thing that, really try to do is I talk to leaders and I have conversations of all kinds. I've heard every argument, every, pretty aggressive statement, some non-people centric statements that are, addicts take care of themselves. Hey, we lose an addict, what's the big deal? Things like that. I've heard these conversations multiple times. I know that every single person comes to this conversation with their own set of circumstances, history, trauma, things that they've experienced in their life. I come from a family of addiction, generations long. So there's a certain amount of trauma that sits inside me, and I get it. Sometimes it's not something you really want to do. But I think at the very end of the day, that no matter what you've gone through, I think the impression that is difficult to impart upon people, but necessary to, is that the work must be done. We're losing people at staggering rates. And so I think if there's anything I'm frustrated with, it's that there's so much bad information out there. There's so many things that, we have to take these myths and dispel them. But at the end of the day, if you really think about it the other way and think about the opportunity that I get to dispel those myths, that I get to help folks understand, it really creates an immense amount of gratitude for the opportunity to help. And so I'd say my frustration can equally be turned into an opportunity with just a little bit of gratitude.
Fair enough. Fair enough. So, of course, we're not going to end on what frustrates us. So tell me what gives you hope.
Oh, man.
Either one of you.
What gives me hope is we do have early adopters. We do have a community. We do have best practices. There are leaders. Nick is one that refills my tank every time I have a conversation with him. And Sonya, much like the work that you and I do in our collaborations, it's that critical mass that's going to take us to that next level. So what gives me hope is we do have successes. I've seen it now with naloxone. Many of the barriers that had existed are being broken down. So we do have a nearing inflection point, I believe, on recovery-friendly workplaces. I think people are recognizing we do lose too many people. 70% of people with substance use disorder are attributed to being in the workplace. 2 out of 3 U.S. families have experienced substance use. We can avoid the pain of the past by embracing a new future. And I think Nick and I have been describing that future today.
Absolutely. Nick, how about you? What gives you hope?
Recovery heroes. Every single success story that I see, get to be a part of, hear others tell me about, hear directly from the folks that are in active recovery, the lives that are saved every single day make it absolutely worth all of the effort and intention and energy that it takes to move this work forward. So very simply, it's life that gives me hope.
That's perfect. Final thoughts from either one of you before I ask our parting question.
Sonya, thanks for the opportunity to have this conversation. Thanks for bringing Nick. We never have enough time, but boy, you've been generous in covering this topic during October, which is normally Prevention Month. My final thought would be, I hope going forward, our industry will embrace September 2026 and beyond as both Recovery Month and Suicide Prevention Awareness Month. So that's my parting thought. Thank you, Sonya.
Nick.
Yeah, I'm with you there. I'm with you there, Cal. We just did some fundraising for recovery this month, and through partnership with AGC, ASA, and many others, on November 14th, we're holding a health and safety summit here in Denver, Colorado. And that summit is primarily set up to have the conversation around suicide and overdose prevention, as well as transformational leadership, to encourage this industry to create some education where knowledge gaps may lie, and to hopefully empower folks to be able to go out and save lives in this industry that needs so many lives saved. So thank you. Agree with Cal. I'm unbelievably generous to have so much time, effort from the CIASP. I mean, this is technically not even your purview or your guys' focus, but to open up the conversation and make sure that what I believe to be inextricably linked, the issues of suicide and overdose and substance use, thanks for having the conversation and allowing us to.
Well, thank you for supporting us through that conversation. And we too agree that there is an intersection. So it very much falls into the conversation that we have to have. Nick, we do something on each one of our podcasts, and I've already asked Cal this question, but we ask people, because it's something that CIASP has embraced this year and each of us have embraced it. What would your word of the year be?
I touched on it just moments ago, and it's something that I try to hold with me as a mantra as I move through every single day. It's tough. I don't always do it, but it's gratitude for certain. Gratitude allows me to remove pride and ego from the situation, understand how many unbelievable people there are that are ready and willing to be a part of the things that we're all working towards, having a shared vision of enhancing and saving lives. And gratitude allows me to create partnerships, friendships in such a meaningful and authentic way. I can't do my life without gratitude. I can't work through my own mental health issues without remembering what I need to be thankful for every single day. And so if I didn't have that, if it wasn't my mantra, I don't even really know where my true north would be. So that's an easy one. It's gratitude with a penny.
Awesome. Cal, remind us again what your word is.
Boy, I'm remembering it was intentionality. I hope I'm correct. And hope, I think, was the second one that I listed. I knew Nick's was going to be gratitude, the way he spoke of it today. And I wrote it down on my little sheet of paper next to me. And I love that, Nick, and the way you described it spoke to me as well. Thank you.
You can read.
And I look forward to seeing you in November.
Yeah.
Yeah, right back at you, buddy. I'm very, very excited. Thank you so much for agreeing to be the keynote speaker. And I can't wait to get to hang out with you.
To just be with you and your community is going to be so exciting and a great way to almost wrap up the year, right? Thank you, Nick. Thanks, Sonya.
Thank you both. And I will say my word is intentionality. So with intentionality, hope, and gratitude, we ask that you all take a deeper look at the conversations that you're having in your spaces and places, and have a great day. Thanks, everyone.
Thank you.